Understanding HMPV, a common respiratory virus. HMPV stands for human metapneumovirus, a virus that is part of the Paramyxoviridae family. It's a common virus that infects the respiratory system, which includes your nose, throat and lungs. This virus can spread easily through respiratory droplets when an infected person coughs or sneezes. HMPV is a lot like the common cold, but it can sometimes cause more serious illnesses like bronchitis or pneumonia. These conditions can lead to more severe respiratory issues if not treated properly. Most people who get HMPV experience mild, cold-like symptoms such as a runny nose, cough and fever. However, HMPV can be more serious for young children, older adults and people with weakened immune systems. These individuals may require medical attention to manage their symptoms. These groups are more vulnerable to developing complications, which can include severe respiratory distress and hospitalization. HMPV is a relatively recently discovered virus identified by scientists who were studying respiratory infections. It was first identified in 2001, so we're still learning about it. Ongoing research aims to better understand its behavior and impact on public health. Despite being a newer discovery, it's actually very common. Many people around the world have been infected with HMPV without even realizing it. HMPV is a global virus, meaning it's found all over the world. It affects people of all ages and backgrounds. It commonly circulates during the winter and spring months, similar to the flu season. During these times, it's important to take precautions to prevent the spread of respiratory infections. Recognizing the symptoms of HMPV. HMPV symptoms are very similar to those of other respiratory infections like the common cold. You might experience a runny nose, cough and sore throat. Other common symptoms of HMPV include fever, headache and body aches. Some people may also experience shortness of breath or wheezing. In mild cases, symptoms typically last for a few days to a week. However, some people may develop more severe symptoms that require medical attention. If you or your child experience difficulty breathing, persistent high fever or worsening symptoms, seek medical advice immediately. How HMPV spreads droplets and close contact. HMPV spreads easily from person to person, mainly through respiratory droplets. These droplets are often released when people talk, laugh, or even breathe heavily. When an infected person coughs or sneezes, tiny droplets containing the virus are released into the air. These droplets can travel several feet and linger in the air for a short period. You can become infected by inhaling these droplets or by touching surfaces contaminated with the virus and then touching your face, particularly your nose or mouth. It's important to wash your hands frequently to reduce this risk. Close contact with an infected person also increases the risk of transmission. This is especially true in crowded or enclosed spaces where people are in close proximity. This includes kissing, hugging, or sharing utensils and drinks. Even sharing personal items like towels or toothbrushes can be risky. HMPV can also spread through contact with contaminated objects such as toys, doorknobs, or phones. Regularly disinfecting these items can help prevent the spread of the virus. Prevention is key, protecting yourself and others. In these challenging times, it's essential to take proactive steps to safeguard our health and the health of those around us. Currently, there is no vaccine or specific antiviral treatment for HMPV, therefore prevention is crucial. By following recommended guidelines, we can significantly reduce the risk of infection. Wash your hands frequently with soap and water for at least 20 seconds, making sure to scrub all parts of your hands thoroughly, especially after coughing, sneezing, or blowing your nose. This simple act can remove germs and prevent their spread. Use hand sanitizer if soap and water are not available. Ensure it contains at least 60% alcohol for maximum effectiveness. Cover your mouth and nose with a tissue or your elbow when you cough or sneeze. Dispose of the tissue immediately and wash your hands. This helps prevent the spread of droplets, which can carry the virus to others. Avoid close contact with people who are sick. Maintain a safe distance of at least 6 feet in public spaces. Stay home if you are feeling unwell to prevent spreading the virus to others. Rest and seek medical advice if necessary. Clean and disinfect frequently touched surfaces such as doorknobs, light switches, and phones regularly. This includes items you use daily, ensuring they're free from harmful germs. These measures can help reduce the spread of HMPV and other respiratory infections, protecting both yourself and the community. If you found this information helpful, please like, share, and subscribe to my channel for more updates.